The idea for an advisory panel came about as a result of a review I did for the Centre for Workforce Intelligence about 18 months ago, when we considered how we could improve the way in which the centre operated. And at that time we had a board of governors who were not executive, but sometimes I think there was a view that they were, and we needed to sort out that confusion. And we were very keen to have a team, a panel of eminent experts in the field of healthcare, the NHS, social care and also public health, and that was the genesis of the panel.
The panel will support CfWI in its work in a number of ways, certainly in terms of providing independent strategic advice across the health, public health and social care sectors, but also bringing in high-level views about changing service needs and the workforce implications. The panel will bring expertise from across different sectors, and we'll have expertise on this panel from health, public health, social care, local government and a range of other areas and organisations to benefit the work of CfWI.
I've taken on the position of chair of the panel because after a lifetime of working in the NHS and with social care and with public health, I'm very, very conscious of the absolute importance, the imperative of getting the balance of supply and demand for the workforce as correct and as accurate as we possibly can. And this is a real opportunity for me to bring my experience to bear to try and influence the way in which that is organised in future.
It's really important that the NHS has a place where it can truly think about its long-term workforce needs. And too often we confuse the urgent, the today, with the long term. And so actually my job, the chance to be involved is on behalf of employers, the people who provide healthcare, is to inform that debate and that work to think about the true long-term future of our workforce in the broadest sense possible. So I think it's a fantastic opportunity to work together with a whole range of players in the system who have a shared interest in that truly longer-term perspective.
So there are three benefits that I would like to see come out of being on the panel. The first is, as a stakeholder that uses the CfWI work a lot, it will help connect me to that work, which is a big benefit. But secondly, and perhaps more importantly, that I hope as a part of a group of stakeholders to influence the work programme and ensure that it's meeting the needs of broader stakeholders. And then thirdly, help in the impact that the work has and ensure that it reaches its wider audience.
I'm a nurse by background and I want to champion the voice and be the voice of nurses and midwives to influence the workforce planning of the future. I'd also really be keen to make sure that nurses and midwives have a role to play in the future planning of the workforce so that it meets the new models of care that are being debated now as part of the 5-year forward view.
My hopes for the advisory panel is that it will be the opportunity for the CfWI to engage with a really wide spectrum of representatives from health and social care and industry experts so that we can deliver the best possible services to our commissioners.
I think we do have some really clear aspirations about the work of this panel and its influence on CfWI. We'd expect the panel to be able to influence external stakeholders, work with external stakeholders, and also act as ambassadors for the brand and the work of CfWI.
We're really fortunate because we've been able to recruit a team of experts in National Health Service work, social care and public health. And my aspiration is that we can use our networks, our experience, our expertise to give the Centre for Workforce Intelligence good quality advice about the future development of the business.